Hello. Thank you for being here today. I acknowledge I'm speaking on the traditional territory of Treaty 6 and Treaty 7 peoples, and I acknowledge the Métis people who share a deep connection with this land. My name is Michelle Baer, and I'm the NDP candidate for Red Deer South. I'm joined here today by Dr. Maureen McCall and my colleagues, Jaelene Tweedle, our amazing candidate from Red Deer North, and David Shepherd, the NDP candidate for Edmonton City Centre and health critic, who is a steadfast advocate for better health care for all Albertans. People in Red Deer and across central Alberta have been waiting for better health care. They've been waiting for a family doctor. They've been waiting for surgeries. They've been waiting for ambulances, and sometimes waiting in an ambulance on a road to another city's hospital. They've been waiting in the ER. They've been waiting for a government that will take their concerns seriously. And what they got from the UCP government is empty promises and delays. What they got from the UCP Infrastructure Minister, Nathan Neudorf, brushing off residents' concerns about delays on the project, saying it would be too tedious and time-consuming to explain. That was disrespectful to our community. Unfortunately, we can't trust Danielle Smith or the UCP to respect our community. We can't trust Danielle Smith and the UCP to fix healthcare. And we definitely cannot trust Danielle Smith and the UCP to build the Red Deer Regional Hospital expansion. After 4 years of UCP lies and delays, the 500,000 Red Deer residents and residents of central Alberta who rely on this hospital are sick of waiting. Enough is enough. It's time for action. An NDP government will take action. Earlier this week, we released our costed plan for a better future. It includes an additional $650 million in funding over 3 years for the Red Deer Regional Hospital expansion, over and above what was budgeted by the UCP in 2023. This funding is to accelerate the project, and we have a detailed plan to do that. To share more details, I would like to turn this over now to David Shepherd.
Well, thank you, Michelle. And thank you, Dr. McCall and Jaelene, for standing up for patients, for Albertans who need better health care. I'm excited to have this chance today to share our plan to accelerate the Red Deer Regional Hospital expansion, because this project is so important. And because this project is so important, if we are elected, an Alberta NDP government will mandate the acceleration of the Red Deer Hospital expansion. To do so, we will do the following. We will create a senior director of project management who will be located here in Red Deer as the one central decision maker driving this project forward on time and on budget. We will offer to fund extended construction hours, where it is safe to do so for workers and for patients. We will work closely with stakeholders, including the City of Red Deer, to determine the type of work that could move ahead during extended hours. We will create a dedicated cross-departmental permit team to accelerate permitting. This will include the City of Red Deer, and the collaborative effort will get the project moving and help avoid unnecessary delays. We will also explore an integrated design and construction approach. In this approach, construction of the building envelope begins before the finalized interior design is complete. The government of Alberta has used this approach for schools and seniors facilities before to help expedite construction. We know hospitals are complex, so we would discuss this option with the experts before moving forward. But we want to leave no stone unturned as we determine how best we can accelerate construction. We will take real, tangible steps to accelerate the Red Deer Regional Hospital expansion. And we are open to further advice to move this project ahead and ensure that patients get the care they need when they need it close to home. Now, before I pass this over to Dr. McCall, I want to reiterate our commitment to a fully funded transition plan, developed in consultation with frontline staff to ensure we have a clear and realistic plan to carry us through the years before construction is complete. And that will include addressing emergent needs that simply cannot be put off. And at every stage of this process, we are committed to being transparent and providing regular, consistent updates to the community and to all local leaders. No more hiding important information from the people of this great city, and indeed central Alberta, who have been waiting for this for far too long. I would now like to pass things over to Dr. McCall.
Thank you for having me join you today. My name is Maureen McCall, and for those of you who don't know me, I've been a family doctor for over 35 years. I've spent most of those years practicing right here in Red Deer. I've cared for patients in almost every department and on every ward of our hospital, from the beginning of life on the maternity ward to the end of life on palliative care. I've been an advocate for a new Red Deer hospital for a long time, too long. Families in Red Deer have been waiting for the UCP to make good on their promises, but for 4 years we've been waiting. That's why I'm grateful to Rachel Notley and the Alberta NDP for their commitment to healthcare. 2 weeks ago, Rachel Notley was in town and she committed to accelerating the Red Deer Hospital expansion. Early this week, we saw the NDP's proposed budget to make this accelerated construction timetable a reality. So today, I'm feeling optimistic and excited. I'm excited for my family and for my patients because I have hope that better healthcare is on the way. I'm excited for my colleagues, doctors, nurses, and many incredible allied health professionals who are under so much stress, working for so many years, under-resourced and understaffed, while determined to provide the best possible care. I'm excited for my community because our voices are being heard. We have the opportunity to make a positive change in the lives of Central Albertans. We don't want to send patients away from their families to another city for care, for time-sensitive and life-saving cardiac care, surgeries, and intensive care because we lack those services or specialists or simply lack a bed for them in our hospital. We want to treat them here. We want enough beds, enough services, enough staff to give them the best quality of care. I'm optimistic that we can do it. Thank you. I'm going to hand over to Jaelene now.
Thank you so much, Dr. McCall. You're right, the Red Deer Hospital expansion is so essential to our community. Healthcare has been in crisis under the UCP. Last year, there were 14 ambulances waiting just over here outside our hospital. Those were patients. Our friends, our family, our neighbors left waiting. Surgeries were diverted for 66 days consecutively, and surgeons have said the hospital's ability to perform surgeries could be, quote, on the brink of collapse. And instead of supporting this hospital, the UCP are building private surgical facilities that will divert resources from public health care. They care more about these private operators and shareholders than they do about prioritizing this hospital. ER wait times have also gotten worse every year since 2019, according to data from the Health Quality Council of Alberta. The longest wait times for urgent cases have doubled from 3.7 hours to 8 hours under the UCP. We are saying no to parking lot medicine and yes to the Red Deer Hospital expansion. This project will build 200 new beds, 3 new operating rooms, and finally, a long-anticipated cardiac catheterization lab. It will reduce pressure on our EMS, who are forced to wait in the ambulance bay or even transfer patients to other cities. Our plan to accelerate construction is pragmatic and essential, and we cannot wait to get to work. Thank you, and we'll now take your questions.
So we'll open it now to questions. For those joining by Zoom, it's *9 or the raise hand function. We'll start with questions in person.
Hi, Nav Senga, CTV News Edmonton. This is for David Shepard. What are your thoughts on Jennifer Johnson's comments about transgender children?
The comments that were made by Ms. Johnson were absolutely vile and reprehensible. They are unacceptable from anyone seeking public office. To compare children of Alberta literally to feces is unacceptable. It is fueling the kind of anti-trans hatred that we are seeing far too much of in our society. It's unacceptable. And if she had decency, she would be stepping down from her run as a candidate.
Follow-up, Daniel Smith says, even if Jennifer Johnson is elected, she won't be a member of caucus. What are your thoughts on that?
Ms. Johnson has demonstrated an utter lack of judgment. Her apology is essentially a non-apology. She did not apologize for what she said. She simply said she didn't communicate her views clearly enough. Let me be absolutely clear. There is no appropriate way to communicate the kind of lies, misinformation, and conspiracy theories that are fueling anti-trans hatred. There is no excuse for her views. She has made no apology, and she has no place in our legislature or, in my view, ability to truly represent any of the people of Alberta.
Go to the next person and next question in person.
Thanks, Josh from RD News Now. I'm just wondering, with the hospital subject, if you're going to be accelerating construction, I know we've heard that the completion date will be somewhere between 2030 and 2032. So if you're accelerating construction, do you have a new completion date or year that you could tell people?
I don't think we're in a position to be able to give a specific completion date at this time. What we are putting forward are some concrete measures that we believe could allow us to get it constructed sooner. However, I think it would be important for us to have these conversations with the folks with the expertise to determine just what elements of these initiatives can be moved forward, how quickly they can be moved forward, and how they might reduce the timeline. Because our commitment as an Alberta NDP government is to be transparent and open about that at every stage. So certainly as we received more information and plans were made, we would communicate that clearly with the public and with leaders here in Red Deer and indeed the frontline staff at the hospital.
Similar question on dating. I know Rachel said a couple weeks ago, shovels in the ground for 2024. Are we talking end of 2024, or could we pinpoint that any further?
Again, I think there are some questions we would need to resolve. From this side of the aisle, we do not have access to all of the expertise of government, and due to the lack of transparency from the UCP government, we really don't know what, if any, progress they have actually made towards that work. That is why we are committing to be absolutely open and transparent, as the UCP government has not been, to commit nearly $1 billion over the next 3 years when the UCP has merely committed a third of that amount. We are committed to seeing construction on this project begin in 2024 and then working to accelerate this project as quickly as possible. And at every stage, we will ensure we are informing the people of Central Alberta, leaders here in Red Deer, of that progress.
Hi, this is Lana Michelin from the Red Deer Advocate. You mentioned that there was going to be a new plan
I'm
as
sorry,
to how
I can't quite hear you.
Oh. Lana Michelin from the Red Deer Advocate. I feel like I might as well shout. Anyway, you mentioned that there was going to be a new way that you would go about constructing it from the inside out kind of thing. Can you please elaborate a little bit on that?
Certainly. So what we're speaking about is a process that has been used by the government of Alberta before for construction of some schools or seniors facilities where they needed to meet an expedited timeline. And it involves basically constructing the outer shell of the building while they are still in the process of finalizing the interior design. So that's possible to do because, of course, the outer structure is going to be the same regardless of what the layout inside might be. So it allows some additional flexibility to get some construction underway. So again, we would want to speak directly, I think, with folks in Alberta Infrastructure and others who have done this on previous projects to fully understand the process that would be involved. But we believe it's a process that would allow us to perhaps get construction underway more quickly.
I think the problem with that the doctors have put forward is that there was no transition plan. So it's more what's happening inside the hospital that is, I think, of concern than getting the outside done first. So I'm just wondering if you could mention something that could be done in terms of transitioning and dealing with some of the urgent needs, like in the 7 or 5 years or whatever that you planned to put the construction into place.
Absolutely. You know, frontline physicians here at the hospital and other community advocates have been absolutely clear that we cannot, the people of Red Deer, the people of Central Alberta, cannot wait 5 to 7 years for the construction to be completed. There are immediate and pressing health needs in the community, many of which have been exacerbated by the poor judgment and bad decisions of the UCP government. So what I can say is that transition plan has to be informed by the people on the front lines. As opposition, we have not had the opportunity to undertake such consultation yet, but it would be one of the #1 priorities of an Alberta NDP government to immediately sit down with those frontline physicians, other advocates at the table, to immediately hear from them what steps they could recommend, what ideas they might have for immediate steps we could take to address some of these pressing needs while construction is taking place.
Perfect. We'll do one more pass for questions in person. Seeing none, we'll go to the Zoom. Again, it's the raise hand function or *9. Seeing none, that concludes today's press conference. Thank you very much.
Thank you.